When a baby is born, he is a helpless creature with very little motor control. But by his first birthday, he is a mobile, independent toddler. So what happens in between? Let's briefly explore gross motor milestones in the first year of life. The newborn has spent 9 months tightly packaged in the mother's womb, and posture is dominated by physiological flexion. The infant's spine is curved and the limbs are flexed and held close to the body. Many movements and postures at this age are reflexive. On his tummy, the baby's arms and legs are flexed up under the body, with the weight shifted forward onto the chest, neck, and head. He has little to no head control and may be able to extend his neck just enough to drag his face from side to side. In sitting, the baby has no trunk control and requires full support. He bobs his unsupported head and may hold it upright momentarily at best. When placed in a standing position, the newborn may reflexively bear weight on the legs and will sometimes even take some reflexive steps forward. After 3 months of moving in a world with gravity, and hopefully lots of tummy time, physiological flexion has diminished and the baby now has strength to extend his head, neck, and trunk. The 3-month-old can shift his weight back onto his lower trunk and pelvis and lift his head completely upright to 90 degrees and prop up on his elbows when placed on his tummy. On his back, the baby is able to keep his head in midline and may bring his hands together or even put them in his mouth. In a supported sitting position, the baby can lift his head and neck, keeping them upright and in midline, but he is unable to sit independently for any length of time. Reflexive standing and stepping have disappeared, and the infant may not bear any weight when caregivers attempt to place him in a supported standing position. By 6 months, the baby has gained trunk control and is able to sit independently when placed. He is still a bit unsteady when sitting and may fall after a few seconds. He probably cannot yet use his hands to play with a toy in sitting or move in and out of a sitting position on his own. On his tummy, the baby will lift his head and bear weight on extended arms, raising his chest, head, and neck off the surface. He may come to a hands and knees position and even rock back and forth, but he is probably not yet creeping or crawling forward. On his back, the baby now has sufficient abdominal strength to curl his trunk, lift his pelvis, and grab his feet and toes. He is now able to roll from his tummy to his back and can probably roll from his back to his tummy as well. At this age, the baby's legs are strong enough to support his body, and he can stand with his hands held, but he is probably not yet attempting to take any steps. By 9 months, most babies have achieved some sort of independent mobility, whether it be rolling across the room, army crawling, or creeping on hands and knees. No matter what movement solution he has found, the baby can now actively explore his world. The infant has now gained control of his lower trunk, pelvis, and hips. He sits well, can move in and out of a sitting position, and pulls himself to standing at a stable surface such as the couch or living room coffee table. At this age, most babies can take steps with their hands held, and some have begun to cruise by stepping side to side while holding a stable surface. More precocious infants may begin to let go and stand independently for a few seconds or even take a few early unsteady steps. By the first birthday, most babies have taken their very first steps. However, creeping or crawling may still be the primary means of mobility, especially when baby wants to get somewhere fast or is in a new or uncertain environment. And some babies are still holding on and don't take their first steps for another month or 2 or more after their first birthday. More adventurous babies may be attempting to crawl upstairs or climb onto low stools or low furniture. Babies with more advanced motor skills may attempt to squat and will begin to practice lowering themselves with control and returning to standing without falling down. Please keep in mind that while this video presents average ages when children reach selected motor milestones, every child develops at his or her own rate and in his or her own way. Development can be heavily influenced by individual differences in the child or external factors such as the child's environment or culture. It is much more important to compare a child to himself when assessing his gross motor development over time, rather than comparing him to what is, quote, normal. As long as a child is developing and making gross motor gains, he is probably gaining skills at a rate that is just right for him. Gross motor milestones are just one small piece of the developmental puzzle.